If you're on the difficult journey of fertility treatment, that one goal, having a baby, it's everything. And in that search for hope, you're going to hear a lot about add-ons, these extra treatments that promise to boost your chances. But what are they really adding? Come on, let's separate the hope from the hype.
Wow, this quote right here, it gets right to the heart of it, doesn't it? It's suggesting that for all their big promises, these extras might just be adding more stress and expense than actual success. So the big question is, are these add-ons a breakthrough or are they just a burden?
And look, you can totally see why they're so tempting. The emotional pull, that deep, deep desire for a child, it's incredibly powerful. And when you're in that vulnerable state, any offer of an edge, any little thing that might improve the odds, it feels like a lifeline you just have to grab.
You also have to remember, there's a business side to all of this. Fertility treatment is a really competitive field. Clinics want to offer the latest and greatest, and patients, of course, are looking for the clinic that gives them the most hope. This dynamic creates the perfect breeding ground for these extras to just pop up everywhere.
All right, so that brings us to the big question. What in the world are these add-ons, really? Let's break down the promise they're selling versus the actual proof that's backing them up. Basically, the definition is pretty simple. An add-on is just anything that isn't part of a standard run-of-the-mill IVF protocol. It's an optional extra sold on the hope, and that word is key here, the hope that it will improve your chances. And they come in all shapes and sizes. We're talking about extra drugs like growth hormone, fancy lab techniques like assisted hatching or a so-called embryo glue, or even extra procedures like an endometrial scratch. I bet you've probably heard of at least a few of these.
But here's a really crucial piece of context. Medical science is always changing. Some things that were once considered an add-on, like ICSI for male factor infertility, well, they've become a totally standard proven practice. But others, they've just kind of faded away. It's a great reminder that new doesn't automatically mean better.
So now, this is where the rubber meets the road. We have to follow the evidence. This is where we shift from what could work in theory to what has actually been proven to work in the real world.
And this is a tough thing to talk about, but it's so important. That deep desire to have a child can make you willing to try just about anything. And while clinics are there to help, this dynamic can unfortunately create an environment where unproven, often expensive treatments can really take hold.
And this history is exactly why we have to be so careful. We've seen the absolutely devastating long-term consequences of interventions in reproduction that just weren't tested properly. From thalidomide to DES, the lesson is crystal clear. When you are dealing with the creation of life, the standard for safety and evidence has to be sky high.
Which brings us right back to today. With that history in our minds, we have to ask the most direct question there is. For all the promise, is there solid proof that today's add-ons actually lead to more babies?
You know, part of the confusion comes from how success gets measured. An add-on might look good on paper because it improves these secondary things, like how many eggs you get or how an embryo looks under a microscope. But what really matters to you, what matters to any patient, is the one and only goal, a healthy live birth. And when you focus on that specific goal, the picture gets a whole lot clearer. Take endometrial scratching, for example. The claim was it improved implantation. But strong, recent trials, they show little to no benefit for live birth rates. And you see this pattern over and over again, a promising idea that just doesn't hold up when it's put to the test in big studies.
So you're probably asking, if the evidence is so weak, why are these things everywhere? Well, the answer often comes down to something called the herd effect, and it's got less to do with medical proof and a whole lot more to do with market pressure. And here's pretty much how it works. Step 1. A new technique gets marketed, maybe online or in support groups. Step 2. Hopeful patients hear about it and start asking their doctors for it. Step 3. Clinics, not wanting to seem behind the times or lose patients to the clinic down the street, start offering it. And bam, just like that, an unproven and sometimes really expensive treatment becomes common practice.
And just to make things even more confusing, you'll sometimes see studies that seem to support an add-on. But you gotta look closer, because this proof can be really shaky. For instance, a big meta-analysis that lumps together a bunch of small studies is only as good as the studies it's based on. And when something's called statistically significant, that might only mean a tiny, tiny benefit, one that doesn't really move the needle on your actual chance of having a baby.
And this is just so important. The American Statistical Association has practically begged science to look beyond these simple statistical tricks.
And you could argue that nowhere is that more critical than in fertility medicine, where the things we do affect not just one life, but generations to come.
Okay, so with all this complexity and all this noise, what can you do? Well, this is about turning that confusion into clarity and empowering you to have a much better, much smarter conversation with your doctor.
The goal here isn't to just dismiss everything out of hand. It's about becoming an informed partner in your own care. So how do you actually navigate this landscape of hope and hype?
It really starts with asking the right questions. Not just, hey, could this help? But is this proven to help a patient with my specific situation? Ask to see the evidence for an increase in live birth rates, not just these other secondary metrics. And always, always ask about the risks and how much it's going to cost. This puts you back in the driver's seat.
Because here's the hard truth. When you strip it all away, the evidence strongly suggests that for most people, the main things unproven add-ons reliably add to your IVF cycle are more cost, more confusion, and more complexity. And those are three things that absolutely nobody needs more of on this journey. So it all comes down to this one simple but powerful shift in your mindset. Change the question you're asking. Go from a hopeful, could it help, to an empowered, is it proven to help? That simple change reframes the entire conversation and puts the focus right back where it belongs, on solid evidence, on clarity, and on your best path forward.